You make my world a better place.
Yes.
We'll get you walking again soon.
That's good. Despite it looking like everything moves pretty slowly around here, things happen.
It's Chris's second week volunteering with the busy Esther Honey Foundation in the Cook Islands.
They've had a lady call in from an outer island, Atataki, which is about 300 kilometres away, with a cat that has part of its nose missing. She's already on her way in now.
Emergency arrivals like this are not unusual for Cook Island pet owners, and Chris is currently one of just a handful of vets on call.
It's a bit of a new situation to be waiting for an animal to arrive, but it's an important one. You're right there. You're Poppy, right? Hello, how are you? Hey, lovely to meet you.
Thank you.
The small one?
Yes.
Oh, wow. Yeah, it's nasty. My first impressions looking into the cage there and seeing small one's nose are that, look, it could be a lot of things. It could be an open wound from a fight, it could be a nasty infection, it could be a virus, or, worst case scenario, it could be cancer. We'll get to the clinic as quickly as we can.
So small one is really important to us, and we are really concerned about the sore on her nose. That's why I've just flown in. She's got the opportunity today to see Chris, so hopefully we'll have a good outcome to this long journey and the long day ahead.
Okay, come through here.
Thank you. Yeah, thank you for seeing her. We really appreciate it.
All right. Here we go. Yeah, wow. So, I mean, that's the first good look I've had at that nose. It's obvious that a big chunk of that nose is missing. So how long's that all been happening for?
So probably 4 weeks ago she had a cold.
Yep.
And then her nose ran and she constantly licked, and because her tongue is like sandpaper, she licked a divot between her lip and her nose.
Yep.
And it's just got steadily worse. For the last 4 days, it started to bleed.
I guess the sign of that blood probably made you more worried.
Yeah, that's just saying it's time to do something.
Yeah. Small one has lost a massive amount of her nose, and it's happened quickly. So obviously, that's of huge concern. What we're dealing with here is clearly very serious. If her temperature's normal, then we start to get to the stage where we can start to rule out a virus.
Yeah.
A bit over 38 at 38.1, 38.2 now. Okay, so that's normal. Yeah. So a lot of the viruses we worried about that can cause erosions around the face of cats, they usually cause ulcers on the tongue or serious irritations and really red inflammation around the mouth. Okay, let's have a look in here. So this is obviously the problem area.
That's okay.
Her gum colour's nice and pink, so she's got some good circulation happening.
That's good.
Despite her having a big problem around her nose, the inside of her mouth is actually looking pretty good. There's no doubting how much Poppy cares for small one. She's just flown over an hour just to have her seen by a vet. My concern is, though, how's she going to handle the news if it's not good? Look at that, and she's lost about 1 centimetre of her nose there. Losing that much of your nose, it's certainly not normal. What I guess has worried me ever since I first saw her is that she actually may have something a little nastier there.
I'm upset, yeah, because I had hoped that it would be a virus. But I think because it's happened so quickly, it's hard to comprehend that it's a huge thing. It's a lot to take in at the moment.
I'm excited about today. I'm on the other side of the country in Broome. I'm here to help out a good mate. He said to me, Tim, I've seen you move a few crocs before, but how about you come and help me with Bluey?
At the Broome Wilderness Park, Big Bluey already knows something's up, and croc keeper Dave Tapper is anxiously waiting for Tim to arrive so they can start relocating the massive beast.
Good morning, mate.
Hey, Tim. How you going, mate?
I'm good.
That's good.
How are you?
Yeah, well.
Big day?
Yep, big day planned.
Where is he?
Just up the way there. I've got a couple of boys just keeping an eye on him at the moment.
Let's go.
Yep.
Bluey will be one of the star attractions at the new park, 16 kilometres away.
Bluey, there's a bit of a story. He was captured from the wild. He was eating horses on a cattle station. So, problem croc. And he's been here for about 15 years and he's very loved. He's a real character. But he's 5 metres, 500 kilos, maybe more.
A huge team of helpers has been rounded up for today's operation.
This is a big move. We've got a big croc, very dangerous, especially for us, but also for the croc. It needs to happen smooth. It's high alert and we need to be careful at every stage.
All right, so everyone's ready? All right.
All right, guys. Dave, Chris and I go into Bluey's yard and he's nowhere to be seen. Just watch that rope, hey? Bang! There's Bluey. He's out and he's right into position. Whoa! That first rope needs to go on now. We need to have our wits about us because a croc like this, make a mistake, you only get one chance.
I can certainly sense some urgency from you, and the reason there's some urgency coming back from me is because there's not a lot more of her nose that she can afford to lose.
Yeah, we're more than worried. Yeah.
In the Cook Islands, Poppy is desperate for help for her much-loved cat, Small One.
My concern is that the tip of her nose, in the last month or so, has developed a skin cancer. The problem with the types of skin cancers that cats get, they're not melanomas. They're not going to spread around the rest of the body like a melanoma can. But what the skin cancers they get actually do is they start to eat away at the area that they're growing in. And cats get something called squamous cell carcinomas. When you look at Small One, unfortunately for her, her nose doesn't have any pigment. It's not black, it's white. And with that white colour means there's no protection against the sun.
So if we had left this, she would probably have died.
Yeah. So that
Shortly.
Yeah, that cancer will eat into her face.
Okay.
And will continue to do so until it's just too much for her.
It probably feels like we've let her down a little bit.
No, you haven't. You've just flown
I
an
know.
hour from another island
Yeah.
to come to a vet to help her out. And her best chance of having a life after today is in acting right now. All right? I know that's a lot to take on. Usually working out a solution as to how you're going to remove this kind of cancer takes weeks or even months. Right now, I've got hours. We don't have the luxury of taking a biopsy and sending it off to a lab and waiting for the test results. We've got one day to fix her.
Yeah.
And that day has to be today. Don't want to muck about. I want to actually take her into surgery right now, if that's okay with you.
Yeah. We would really, I mean, obviously we really love her.
Yeah.
I can't really go in without her.
Well, let's make sure that doesn't happen, huh?
Please. Yeah.
I'm looking at Poppy and the love that she clearly has for a cat. She's heartbroken right now, but what she's hanging out for is some hope. I'm hoping I can give it to her.
In Broome, Killer Croc Bluey is putting up a fight.
Jeez. Rightio. Feedback on that, Tim?
Yep.
Pull back.
Some of it.
The massive beast is using all his 500 kilos to resist efforts to get him out of his pond.
It's gonna roll.
Okay, just hold it there. Keep the tension on.
Let him roll.
Perfect.
A bit of slack, guys.
Tim has been asked to help move the 5-metre monster to the new crocodile park.
This is where it gets hard. Bluey's got the first rope on and he's thrashing about. All we can do is try and hold on, but he's way too strong for us.
Right, now pull back.
Let him roll. A bit of slack.
It's an epic struggle.
Let him roll.
The angry croc wants to retreat back into his pond.
Hold up, boys, not too much on him.
Then suddenly he starts heading straight for the fence.
Just keep the pressure.
Jeez. Bluey has the ropes on and he's doing big death rolls. And he hits the fence, bites it and rolls into it. He's that powerful. This is a problem because if he can't get himself unstuck, I don't know what we do.
In the struggle to free himself, the giant croc is now also using up too much energy.
Big crocs like this can build up lactic acid. That can kill them. That happens because they struggle and they stress out. Do you want us to give him a bit of slack for a sec?
Yeah. Just a little bit, yeah.
Little bit of slack on.
The team is running out of time. They now have just precious seconds to try to release the agitated croc.
This needs to be fast. If Bluey overheats, he'll die. Come on.
Oh, ouchie.
Yeah.
Doesn't look very nice, does it?
No, it doesn't. Hopefully today ends all that.
At the Esther Honey Foundation in the Cook Islands, the procedure to remove the aggressive skin cancer eating into small one's face is about to begin.
It's okay.
I'm just trying to remove some dead cells from the surface, and already you can see the problem with this nose is that the blood supply is so great that we're getting a lot of blood coming out straight away. The fact is, if I was back in Australia, I'd use radiation therapy to treat this kind of cancer. Now, I cannot import that technology into the Cook Islands to use it on small one. It's just not possible. So we have to go with the next available option. All right, if she's stable, I might start freezing now.
Faced with limited resources, Chris decides to use human medication to try to kill the cancer cells.
So we're just going to do about 30-second applications there.
Okay.
He's using a wart removal treatment containing liquid nitrogen.
Oh, wow.
It's working well.
Yeah.
Yeah. The whole idea here is to use multiple cycles of freezing, thawing, and that way the problem cells, they defrost, they expand when they're frozen, and hopefully then they pop. Then you let them defrost, then freeze them again. That process should actually kill them.
That's 30.
Using a wart removal treatment seems like a crazy idea, but you've got to remember, warts are essentially benign growths. So the same principle applies. You have to penetrate through the outer tissue, get to where that whole tumour is coming from, and kill off those cells. So we can see that we're getting a nice line of frozen tissue coming away from where I'm applying this, which is exactly what I'm looking for.
5 more seconds. Okay.
I'm probably being a little bit more aggressive than I normally would be, but the way I see it is this may be the only treatment that small one gets.
That's 30.
It's an anxious wait for small one's owner, Poppy.
Nervous. I suppose that's probably all I can think. It's just apprehensive, hopeful.
Just going to do one more. Okay, all right. We're done. The hope is that over the next few days we get a scab forming. It'll then drop off, and underneath that should be healthy tissue. You're just waking up, aren't you? There we go, big yawn. It's gone well.
Has it?
Yeah, it has.
Okay.
You can relax.
All right.
Yeah. So we've managed to freeze those sections of the nose 3 times.
Wow.
So we gave it a really good go. Okay, and she's just waking up now, and
Right.
she seems pretty happy there.
Some people might say it's just a cat, but it's still part of your family. Definitely wanted to make sure that we've done everything we can to give her the best opportunity, and I think we've done that. Yeah, you're great. Thank you so much. Yeah, really appreciate it.
When it comes to commitment, Poppy is right up there because her love and devotion towards small one just cannot be questioned. This cat clearly means the world to her.
Good boy, come here, rascal. Hey, you rascal.
A young Border Collie has been rushed into the Bondi Referral Hospital, Sash.
Rocket ate a loaf of bread that I was making, and nearly an entire loaf. There was all bar about 1 bun's worth left.
What about this big?
And we've noticed he's been expanding ever since, and looks like he's about to give birth to a litter of buns.
Katie and her children are worried about the greedy pup's behaviour.
Rocket has been known to eat quite a few things that he's not supposed to. So far he's eaten the arm out of a chair, he's eaten underpants, bras, t-shirts, socks, several pairs of shoes. So he's got good taste, but a bit naughty.
Hello. Got 4. 4 children here. Which one's Rocket?
The big fat one, full of dough.
Hi, sweetheart. What did you do? Come through.
Thank you.
When Katie first arrives, she thinks Rocket has been up to his old tricks again, eating something he shouldn't have. And as soon as I look at Rocket, the first thing I see is that his abdomen is really, really big.
He's pulled down a tray of dough, and it was quite a large amount. I'd made 2 breadsticks.
Okay. The biggest concern is that when they have eaten dough and that yeast rises, that yeast can form alcohol.
Okay.
And then he can actually get alcohol poisoning from it as that alcohol gets absorbed into his bloodstream. So it's a really, really serious problem. It can be fatal. Katie's face literally drops when I tell her how serious alcohol poisoning can be. Yeah, so his tummy is feeling really full and uncomfortable there.
Yep.
As time passes, Rocket's stomach is getting bigger and bigger, which means that dough is continuing to rise as if his stomach is an oven. So the plan is I'm going to take him out into the treatment room.
Yep.
I'm going to give him an injection to make him vomit.
Okay.
If he doesn't bring up the dough, then we'll have to give him an anaesthetic and pump his stomach.
Yep.
If we can't get it out that way, he'll have to have surgery to have the ball of dough taken out of his tummy.
I understand. Oh my God, I could really lose my dog. And yeah, that's not a place we want to even go. We lost a dog a couple of years ago, and the family's not really been the same since.
Come on, Rocket. Come on, bud. I know it's scary. Come on, doll.
Okay, the wait is over. Here she is. So she's had a good chance to rest.
Hello.
He's still a little bit drowsy, but...
In the Cook Islands, it's been 2 hours since Small One's unconventional procedure to remove the aggressive skin cancer attacking her face.
Small One. Hello.
Straight back to you.
Did you miss me? Let me see. Hello. Let me see. Oh, that looks excellent. Look at you.
Yeah, so it's just going to dry out a little bit, and she may get a little scab forming there.
Hello.
But
Yes, I'm here. I know. That's okay. Oh, good.
seeing Papa's reaction to having Small One back by her side, you'd think they'd been separated for days, not hours. But it just shows you, no matter the language, no matter the country, no matter the destination, that commitment and that love for pets is just the same.
There we go. Good girl. Good girl. There we go. Come on, Small One. That's all right. There
All right.
we go. Time to go home.
I'll take you to the airport.
Excellent.
You ready to fly now? Go back to the island?
I feel like we've achieved something today, and I just want to get her home so we can get life back to normal for her and for me. It's been great. Really pleased.
She's going to become a frequent flyer.
I think so too. She gets some air miles.
There's no way of knowing exactly how much time we've managed to buy Small One through doing this procedure. But the fact is, without it, she was seriously on borrowed time. You can never accuse Poppy of not moving heaven and earth to do everything she can for her Small One. So the two of them, they deserve so many more happy years together.
Appreciate it.
Thank you. My absolute pleasure.
Thank you so much. To everybody, eh?
Okay.
All right.
I'll be checking in, okay?
Make sure you do.
You've just given me a reason to visit Atutaki for a holiday.
I might have to do that again.
A working holiday.
All right.
All right, safe flight.
Thank you very much.
See you soon. Bye-bye.
See ya.
All right, Sam, we're going to just give this IV. It's an injection to make him vomit. All right, buddy, it's just going to be a little sting.
At Sash, greedy young Border Collie Rocket is in grave danger after gorging on a huge batch of bread dough.
Eating raw bread dough is a serious emergency in a dog. That dough rises from the yeast, and as the yeast releases alcohol into the bloodstream, that dog is going to get alcohol poisoning, and that can lead to death very quickly.
It's okay. Look at me. What's going on?
It's now a race against time to get the fermenting dough out of the young pup's stomach.
All done.
Done. It was like a little bee sting. Hopefully Rocket will respond to this injection and will vomit up the bread dough, because if he doesn't, things are going to be a lot more serious for him. I know, I'm sorry I've made you feel sick. Hey, bud. Good boy. Here you go, darling. Let's get it all out. That's the way. Come on, hun. Good boy. That's a nice big amount. Let's get it out. Out it goes. Oh, good boy. Hey, that's a nice big one. I wasn't expecting such a big vomit. Rocket hasn't stopped vomiting. There is just more bread dough pouring out of his mouth. His stomach was absolutely packed with the stuff. Good boy. Oh, there you go, sweetie. As much as I hate making dogs vomit, I kind of feel good about making Rocket vomit because he's brought up this big lump of dough and he's potentially saved his own life. So there was the one piece of bread, there, and here's the other piece of bread. And then the rest of the liquid is probably just, it's starting to be digested. That is disgusting, buddy. Rocket's sitting there with a very sad and sorry look on his face. And I think he's feeling a little bit guilty too.
But the exhausted pup's ordeal is not over yet. Lisa wants to run urgent blood tests, and the pup will have to stay overnight at Sash.
We're running some blood tests on Rocket now. We need to make sure he's not developing signs of alcohol poisoning and that he's not becoming dehydrated. We'll have to keep a really close eye on him while he's in hospital with us.
There we go.
In Broome, gigantic croc Bluey is gradually untangling himself from a perimeter fence.
Rightio, pull away.
The massive 5-metre croc is being relocated to a larger wildlife park.
With a bit of encouragement, thankfully, Bluey unrolls himself and it's game on.
Okay, hold the tension on there.
Yeah. We'll let him turn, eh? That's it.
Perfect. I want to try and keep him off the fence, so give him a little bit of slack.
Little bit more, little bit more.
Hold on, just hold your ground.
Now it's all hands on deck. Keep that pressure on Bluey. There's a few of us working in and around him. If the guys don't keep the pressure on, he's going to whack one of us.
Okay, Pete, you got your advertise? Perfect.
Finally, Bluey is subdued. The team needs to quickly tape up his lethal jaws before they inflict any damage.
Once his jaws are restrained, then we take a little breath because he can't bite anymore. Happy?
Snap it off, mate. Perfect.
Now we've got the jaws secured. The main thing we've got to watch out for is when Bluey rolls or thrashes that tail about. He can break your leg, pop your knee, really easy.
Put a couple of you on the tail, couple grab the legs.
You have to give us a hand here on this one, mate. You got that one? Let's work on that one first. Fair enough.
Bluey won't stay quiet for long, so Tim and the team need to keep moving.
Crocodiles expend energy and they need a little bit of time to reboot. So by moving him quickly, we're hoping to avoid that point where he's able to build up fresh energy and become a problem. Rightio.
Ready? One,
grab hold, Pete. Go. Pull. That's it. Perfect. Turn him a bit.
That went well. He bowled himself up in the fence for a minute, but he came right back out. Good capture.
Okay, stop. Perfect.
Now we need to move quick and get him to his new home before that lactic acid builds up, because that can really hurt him. That went well, Dave?
Yeah, so far so good.
It's a new experience for you, isn't it?
At the Esther Honey Foundation in the Cook Islands, Chris's next patient is already waiting.
Hello.
Hello.
How are you?
I'm good, thank you. How are you?
Good, I'm Chris.
I'm Virginia.
Nice to meet you, Virginia. I'm doing some work here.
Oh, it's great that you are.
Who's this?
This is Lady.
Hello, everyone. Hey, how are you? This is sniffing me out. You're not from around here, are you? All right, what's Lady's problem?
She's got a sore ear. When you touch her left ear, she cries.
Devoted owner Virginia has been trying to get help for Lady's chronic ear problem for the last 4 years.
Did have it looked at, but they said it was sensitive ears. I'd tell everyone not to touch her ears because she'd cry. It's all right, it's all right.
She's just whimpering when I touch her around there. She's a real softie, isn't she?
Yes, she's a beautiful dog. It's all right. All right. It's all right. Yes, it's all right. It's all right.
Given how strong the connection is between Virginia and Lady, it must have been so hard for Virginia to watch Lady have this ear problem for all these years. Is the ear problem an issue all year round?
No, it seems to get worse when it's the summer, when it starts getting humid and hot, and she goes down to the sea and goes for a swim and then goes fishing.
Fishing?
Fishing, yes.
She's a fishing dog?
She's a fishing dog.
Well, I wouldn't have picked that. There are no fishing dogs in Australia that I know of. They're quite unique. A dog that has fishing as a hobby is a classic example of the fact that the dogs here in the Cook Islands live a very different lifestyle. But for all the differences, there are some similarities as well, because the owners here in the Cook Islands, just like they are back in Bondi, are determined to do everything they can to make sure they stay as healthy as possible.
It's all right. Good kid.
Virginia has high hopes that Chris will finally be able to fix her special girl.
When I saw in the newspaper that Chris was coming, I thought, right, that's my opportunity. It's all right. All right.
Okay, fellas. Now, this is the bit that's really going to test your mettle. Like I said, he's a very heavy animal, so lift safely, bend at the knees.
In Broome, Big Bluey is about to put Tim and the team to the toughest test of them all.
1, 2, 3. We're a bit light up here.
The 500-kilo heavyweight is being moved to the truck that will take him to the new park site.
Shuffle, shuffle, that's it. Even though we're all prepared and ready for the lift, it still caught everyone by surprise. The immense weight of Bluey is a real struggle. Okay, and down.
Glad we had a few extra people.
The road trip to Bluey's new home is just 16 kilometres, but every minute he stays restrained is critical.
I'm sure he's stressing out. He's probably wondering what's going on. It's been a long time since he's had ropes on him and been captured, and our whole operation, of course, is to minimise that stress to him.
Got a mattress for under his chest, just to stop the vibration. Now the crane lifts Bluey onto the truck, and we put some wet blankets on him and a shade structure, because we've got a 15-minute journey to Bluey's new home. We need to move fast. If Bluey overheats, he'll die.
I think Pippa's more worried than anyone, isn't she? She misses her big brother already, don't you? Hey?
At Sash, Katie and her family are anxious to find out if Lisa has managed to get the bread dough out of their other puppy's stomach.
When I first saw that he'd eaten a heap of dough and he was feeling a bit sick, I said, well, you brought this on yourself, buddy. That's what happens when you steal things off the bench, because he does it a lot. And yeah, I had no idea that it was actually quite as serious as it was, to be honest.
Hi. Okay.
How is Doughboy?
All right, so the good news is we managed to get him to vomit out quite a lot of that dough.
Good.
So 2 very obvious pieces in there.
Okay.
Because some of it probably has been absorbed already, we do need to keep a close eye on him. So it's for the best if he stays in hospital tonight on a drip, so that we can flush any of the remaining toxin out of his system.
Don't worry, Mike, it's going to be fine.
Rocket is not completely out of the woods. He's still at risk of some form of alcohol poisoning, so we need to have him in hospital on a drip to make sure that he's going to be safe. All right, guys, do you want to come see Rocket?
Yes, please.
Hey, do you want to come see your brother?
Yes, please.
Let's go.
It's going to be really horrible going home without Rocket. The kids are going to miss him. I'm going to miss him. So let's just hope we can pick him up tomorrow and that everything's okay.
Good boy. He feels like he's lost about 3 kilos.
don't you, hey? You got rid of the buns from the oven, hey? I know, I love you too. Yes, I do.
It's really not going to be easy for the family to leave Rocket here in hospital. He's only 1 year old, he's just a baby, and they are really going to miss him. I just hope that I can get him home to them as quickly as possible.
Good boy. Hey? Bye, Rocky. We'll be back soon, okay? You be a good boy. We'll be back soon. Good boy. But I hate walking away seeing him like that, with the drip about to go in and potentially not knowing what the outcome's going to be. So, yeah, we're going to think positively, kids, aren't we?
So she goes in the water a lot then?
Yes.
Okay.
In the Cook Islands, Chris is trying to work out if Lady's unusual hobby is the cause of her chronic ear pain.
She loves going down to the beach, into the water and having a swim and then do a bit of game fishing, I suppose you'd call it. You know, looking for the fish and trying to catch them.
As a vet, you develop some strange skills. And one of them is being able to smell things that don't necessarily smell great.
Yeah.
The smell of her ears is very much like a yeast infection. Yeast infections are normally caused by a bug called Malassezia. It's a normal skin fungus, but what happens is, once moisture gets in there, it multiplies like crazy. It's actually the body's own response to it, the inflammation, that ends up causing the pain. And right now, Lady is in serious pain.
Yeah, I know. Good girl. It's all right. I know.
It's quite sore and sensitive too.
Yep.
We're getting some fairly dark wax in there. So obviously she has some sort of ear infection. A dog's ear goes down and then in. It's like an L shape.
Okay, yeah.
And it's very easy for water to go down and in, but not come back out.
Oh. I'm very surprised because I hadn't thought that the water would actually cause an ear problem.
What I'll do now, though, I'll actually clean her ears out for you now.
Oh, thank you.
And then we'll put some drops in there.
Yep.
And the drops will do two things. They'll take away the swelling, but they'll also treat the infection.
Oh, thank you.
This is obviously the hardest part for Lady. That infection has been festering for a long time. So removing all of it with this solution, it's not going to be comfortable, but at the same time, it's our best chance of curing the problem. So what I'm going to do is put this little mix of antifungal wash into her ears.
Okay.
And then I'm going to suck it back out.
Oh, I know.
Yeah, it's a bit sore, isn't it? So I'll just dry it out.
Oh, baby, it's all right. It's all right. It's all right.
See, look what we're getting out. Ear goobers.
You can smell it now.
Yeah, it's a beautiful smell. It's okay.
All right.
With Lady's ear now clean and dry, antibacterial drops will need to be applied regularly to clear up the infection.
Okay. And we're all done.
Oh, thank you so much.
That's all right.
After 4 years, I'm just so wrapped that we found out what was her problem and she's not going to be in pain anymore. And people can pat her ears that she likes because she likes being scratched. Well, look, thank you.
It's all right, no worries. Lovely to meet you.
It's nice meeting you too.
Nice to meet you, Lady.
Say thank you. Oh, you probably think I'm not going to say thank you.
Good luck fishing.
That's a confident croc.
Yeah, exactly. No, it went pretty well. I was pretty happy.
In Broome, Bluey is finally on his way to his new pond at the relocated Crocodile Park.
Now he's heading home.
Oh, I'm glad for that. The release? Oh, that could be a different story. Yep.
Tim is desperate to get the 500-kilo croc back into the water, so unloading has to get underway as quickly as possible.
Let's get him off. When we let Bluey go, we want to see that he's full of energy. If he's not, and he's lethargic, and he just sits there, that's an indication that he's exhausted. We want to see a firecracker. That means he's got plenty of energy, and this was a success. Point his head right at the water.
The dangerous release is creating plenty of interest.
We've all braced ourselves ready. We just need to get those ropes off quickly, safely, and get out of his way. Rightio, Tim, we're going to get cracking on this?
Yep.
OK. So his legs are free? Right.
What's the tail? My stomach has butterflies. Dave is going to cut all the ropes, cut all the tape. Some people will be on Bluey, and my job is last rope. I'll have the only rope that's holding his jaws shut, so when everything else is gone, I'll hold on tight, and hopefully it unwraps. Hold him. Whoop, whoop.
Hold him, guys, hold him.
This is where someone can get seriously hurt.
All right, clear off. Get back.
Back behind me, Rocco. But Bluey doesn't stick to the plan. As soon as he can feel freedom, whack, he's up. He's okay.
Once he gets a look at that water, he should just walk straight in. It's pleasing to see Bluey have some sort of energy. We know then that he hasn't built up a great deal of lactic acid in his body.
Here we go.
Go on, big boy.
Keep going.
Bluey's finally in. It's been a big day.
It's a real thrill, a real buzz to finally move him. He is a great crocodile, very dynamic. He's great on tour, and it'll be good to see him back on tour and, of course, pleasing the crowd.
Well, he's happy, mate.
Yeah, no, that went pretty well. I'm happy with that too.
He was cheeky.
Oh, yeah. Caught us a little unawares at the end there, but yeah, still went well though.
What a day. A 5-metre saltwater crocodile, captured and successfully removed. That's a good day in my book.
Hey, buddy. How are you feeling today? Hey, come on. How'd you get?
At Sash, it's been 24 hours since Rocket's bread dough binge.
Let's have a feel of your tummy, see how you're feeling.
Lisa had to act fast to induce vomiting to get the fermenting dough out of the dog's stomach.
He's bright, he's happy, his abdomen is no longer filled with gas, and the good news is he hasn't shown any signs of alcohol poisoning, which means that he's ready for some food and hopefully we'll be able to go home. Rocket, have a look what I've got over here, bud. Sit. I think this is wishful thinking, but sit.
With bread off the menu, Rocket will have to settle for good old-fashioned dog food.
Good boy. Rocket has definitely turned a corner today. He's eating well, and I think he's ready to go home.
Have you seen Dr. Lisa yet?
Rocket's welcoming committee is anxiously waiting.
I think we've all missed Rocket very badly, haven't we?
Yeah.
Yeah, he's the main fixture of the household.
He's over there. Come here, buddy. What you doing? Hi. Hello.
I'm pleased to see you too. Oh, no, he's going to try and fight with everyone. Hello. We're pleased to see you too, matey. You've lost a bit of weight. Hey? You lost a couple of loaves. Rocket is a completely different dog from yesterday. He's about half the size that he was. He's full of beans, he's lively. It's good to see him back to his usual naughty self. Thank you so much.
No problem. Oh, thank you. Well, I'll have to keep these ones away from Rocket, I think.
Yes.
knowing his behaviours.
But given what happened.
You know what? I'm just going to pass on bread for a while. When Katie brought Rocket in, I don't think she realised quite how deadly eating dough could be. But he's responded well to the treatment, and luckily he's going home back to his normal self. And hopefully, from now on, she'll be keeping that bread dough well out of reach. Good luck.
Thank you. Thanks very much. He's going to push you.
See you later.
Thank you. Come on. All right.
Now, Amy,
Yeah?
I know you guys are flat out, but I've got to go.
That's too bad.
Thank you for everything.
You're very welcome.
Before I go, though, you guys do pretty amazing things off not very much. So here's a little contribution. Just some medicines, some equipment, bandages, syringes, just the basics.
Chris is about to head home from the Cook Islands, and as a parting gift to the Esther Honey Foundation, he's delivering some much-needed veterinary supplies.
Every little bit helps and that's great. Thank you so much.
Okay. Clearly, someone's very disappointed to see me leave.
Yeah, very disappointed. Very disappointed. Payment for you?
Wow, you pay big bucks.
We do.
And this is going to be a big stomach ache if I eat all of these before the flight, but thank you.
You're welcome. But before you go, there are a few paddlers who want to take you out, paddle boarding. So, yeah.
I've got like maybe 2 hours before the flight.
Yeah, I'd go see him.
One thing I've learned is that island life is never dull. This time, though, I reckon Amy, she's got to be setting me up.
I think I just worked out who the local paddlers are. Wow. I've got to have a go at this.
Turns out the paddlers that Amy sent me to have a paddle with, they're not human. They're hairy. They trust me enough to go for a ride. Come on, good. Your balance needs to improve. Oh, gee. The canine paddling world, it's pretty cut and dry. If they don't like your style, they're out of here. Don't leave me now. Don't leave me. That hurts. Here's you. Swap paddling partners around here. I've got a new partner in crime. This is almost like the aquatic version of The Bachelor. You try different partners, see who works for you, and in the end, hopefully you're happy.
He knows what's up.
Yeah, it's more like it. Sometimes life's all about finding the perfect partner. One that works for you. It's down mine. I can go home now.
Hi, I'm Dr. Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.